CBT for addiction. Part B. Sober breathing space. Stop. Observe. Breathe. Expand. Respond. Not react. Emotions matter. When we experience negative emotions, drugs are more rewarding, as they are reinforced both positively and negatively. Why drugs are addictive. Drugs of abuse such as alcohol, amphetamine and cocaine act as primary reinforcers. This operates directly or indirectly through reward circuit in the brain. Some people find this hard to resist. Assessment and engagement. Begin with current concerns. Explore personal history. Elicit history of substance misuse. Functional analysis is helpful. Work towards formulation. Importance of goal maintenance. Rehearsal plus repetition plus reinforcement equals reversal. Importance of identifying alternative goals and pursuing these in a systematic manner. Treatment barriers. The possible effects of repeated setbacks. Scenario 1, client blames themselves, I am lacking willpower and I am useless anyway. Scenario 2, therapist blames client. Sometimes with their full agreement and collusion. You are not motivated or committed, come back when you are ready. Stop wasting my time. Treatment barriers. Scenario 3. Therapist blames themselves, I am no good at this, my clients never seem to improve. Scenario 4. Client blames therapist, you do not understand me or my problems and the treatment is useless. The 20-20-20 rule. 20 minutes. Review substance misuse. Give motivational feedback. Note current concerns. 20 minutes, introduce session topic e.g. coping with craving and relate to current concerns. 20 minutes. Assign homework and practice exercise for coming week. Anticipate high-risk situations. Overall, always apply social reinforcement to shape behavior. A client who attends for an appointment is always welcomed warmly. Just say no. In relapse prevention when offered drugs. Say no first. Make direct eye contact. Do not be afraid to ask the person to leave you alone. Do not leave the door open to future offers, for instance, I do not feel like it today. Be assertive, not aggressive. Managing craving. Recognize rationalizations about drugs, for instance, life is boring without cocaine, or I deserve a drink. Include categories of testing personal control and permission-giving beliefs. Avoid situations rich in drug cues like parties where drugs are available. Setting alternative goals is often a good strategy. Identify and rehearse coping strategies, for instance, drink refusal skills. Distraction. Challenging thoughts. Review negative consequences, focus on benefits of restraint. Talk to supportive friends or associates on the program. Impulse control. Impulse control and emotional control strategies should be addressed sequentially, but as part of a formulated treatment plan in a framework that accentuates cognitive control. Particular attention must be given to enhancing therapeutic alliance. Continuous feedback is used to motivate the client to remain engaged in treatment despite the inherent treatment-resistant nature of addiction. Be aware. Addiction, once established, is an enduring condition because of the powerful learning mechanisms it subverts. Help seekers and their carers need to remain mindful of this in the years following treatment. What is relapse prevention (RP)? Broadly conceived, RP is a cognitive behavioral treatment with a focus on the maintenance stage of addictive behavior change that has two main goals. To prevent the occurrence of lapses after a commitment to change has been made. To prevent any lapse that does occur from escalating into a full-blown relapse. Ongoing recovery. As CBT treatment continues into later phases of recovery, more emphasis is given to the cognitive part of CBT. This includes teaching clients knowledge about addiction, teaching clients about conditioning, triggers, and craving, teaching clients cognitive skills, thought stopping, and urge surfing, focusing on relapse prevention. Classical conditioning in addiction. Repeated pairings of particular events, emotional states, or cues with substance use can produce craving for that substance. Over time, drug or alcohol use is paired with cues such as money, particular places, people, time of day, and emotions. Eventually, exposure to cues alone produces drug or alcohol cravings or urges that are often followed by substance abuse. Operant conditioning in addiction. Drug use is a behavior that is reinforced by the positive reinforcement that occurs from the pharmacologic properties of the drug. Negative reinforcement occurs when a particular behavior gets stronger by avoiding or stopping a negative condition. For instance, if you are having unpleasant withdrawal symptoms, you can reduce them by taking drugs. End of Part A. Please proceed to Part B.